So we're talking about private healthcare bans in Canada today, and we're chatting with Jeff Krushell, a patient from Edmonton. Jeff, before the break, you were telling us about the excruciating pain that you were experiencing with your back and how you were looking at, I think, fairly long wait time in the public system. Is that correct? How long were you looking at?
Yeah. Yeah, Colin. No, for sure. I got in to see the neurologist, and we all agreed. And it's funny because in his exam room, I was in so much pain. I couldn't get on the exam table. I couldn't stand. The catch 22 was there was a 1 to 2 year wait to get in to get this surgery done. And I'm telling you right now, I couldn't survive another day, week, or month, leave alone 2 years. So it was a real tough spot to be in.
And so, I mean, obviously that's a very difficult situation to deal with because I'm sure it was also affecting not just your pain, but your family, your work, and so forth. What did you do? Could you tell us about the next steps that you took to look at options within Canada and what type of barriers you faced there?
Yeah, so I did do a deep dive. I went coast to coast and I talked to everybody I could possibly talk to see if there were other options to get myself taken care of. And I was actually alarmed and surprised to find out at the end of the day that inside of the borders of Canada, there was no way I could even care for myself. And COVID was going on, so we all understand, I think, the pressure is there, but it was frustrating. There was absolutely no avenues in Canada. The only facility I found that was actually approved by Health Canada to do this type of procedure was a clinic at the Foothills Hospital in Calgary. And I was excited to hear this. I called them right away and said, "Oh, look, I just saw my neurologist. Here's the situation. This is what I need done. Do you do this type of procedure?" They goes, "Well, yes, we do. How soon can you get in?" And I'm like, "Well, how soon can you take me?" And they're saying, "Well, we can get you in as early as the next couple of weeks." And I was excited. I told her I'm 3 hours up the road. I could be there tomorrow afternoon. She goes, "Oh, hold on, Jeff. Are you telling me you're in Alberta?" I said, "Yeah, I'm right up in Edmonton. I could be there tomorrow if we could do it. Let's just work this out." And they go, "Oh, Jeff, unfortunately, because you're an Alberta resident, we can't operate on you." And I'm going, "Hold on a second. You're the only facility in Canada that can take care of me. And because I live in the same province, you can't do the procedure on me." I just can't. I can't even describe the frustration at that point, Colin. And I still don't even quite understand it, despite all the research and people I've talked to. Very frustrating.
And so as a result, you ended up going to Atlanta, correct?
Well, here's what happened next. And listen, I talk about the grips of depression and those dark, dark, dark days. And it got worse after that because there was no options and I was helpless. And I understand, I know people have experienced this pain before, and I feel for every person that had to go through anything even close to what I went through. So I put an email out. My world is sport performance. So I put out an email to all the people I knew in the NFL and the NHL and Europe with all the work, all my sport performance colleagues and friends. And the comeback was great. The offers of help, the suggestions. I got a call from the guys at the Atlanta Braves. They said, "Hey, Jeff, what is going on?" I told them the story. They introduced me to their team neurosurgeon, and we wound up going down at great, great expense to Atlanta to get this taken care of because there was no other option. And I am telling you, there's no way I would have survived without that surgery.
Well, listen, I'm glad that you were able to ultimately get the surgery that you needed. Unfortunately, you faced such an ordeal that you couldn't go down the road to Calgary to get it. We've got about 40 seconds or so. I'm just wondering if you could tell us a little bit about the consequence that later happened with problems that you had with your heart and how your doctors believe that was connected because you had to wait so long for your back surgery.
Yeah, so 4 months out for my surgery, I did a checkup for my back. Everything was good. I got a full physical. The next week, I was out on my mountain bike and had a massive heart attack with no explanation. I've been in shape all my life. I've never smoked. Our diet is incredible. And there was no warning signs. My physical was virtually perfect. So looking back, the weight gain, the stress, because I couldn't move. So I gained weight and I'm still carrying that weight, the depression and stress. And then also, Colin, the chronic pain. And what I've learned now, the correlation between chronic pain and cardiovascular disease is well recognized in the medical science. And it's something we really need to be paying attention to.
Yeah, and that's not something that I've ever thought about, is sort of how chronic pain for so long can ultimately affect your heart. But certainly there are a lot of consequences from patients waiting so long. Jeff, I do want to thank you so much for sharing your story with us here today.